Welcome. My name is Dr. Mario Leyba. I'm a general and robotic surgeon here in Albuquerque, New Mexico. We're going to discuss several things today, specifically regarding patients, how to care for them in surgical wise, and how to make you feel more comfortable. I'm going to see you in my clinic. We're going to talk about things, but today we're going to give you some information so you can process. So when I see you later, we can have a good discussion. Thank you. The reason for making these videos was to help the surgical process along. I've seen it from a surgical standpoint. I know how to do the surgery, I've seen it in clinic and so forth, but I've never really dealt with being a patient. And when patients come to my clinic, oftentimes they're overwhelmed with the amount of knowledge that I give them and other doctors, and they focus on that rather than listening to what's actually going on. So when they go home, their family members ask them, well, what happened? A lot of times they're like, I don't remember anything. So the reason for this is to help educate patients and family members and even providers and other people that want to be involved in the surgical procedures themselves. What is Botox? Botox is a special neurotoxin protein that is injected into the muscles of the face, which temporarily reduces muscle contractions and smooths skin wrinkles in the area injected. It is most commonly used for cosmetic procedures. It can also be used for excessive sweatings of the hands, headaches, and in anal fissures. This picture shows the complex nature of the muscular system of the face. During Botox injection, several of these muscles may be targeted for injection, which help diminish wrinkles. In this picture, you can notice there are several types of wrinkle patterns: forehead, around the eyes, and around the mouth. This relates to how the muscle contracts and it gives the wrinkle pattern. Botox injection is going to target those specific muscles and help relax those muscles to smoothen out those wrinkles. There are various dosages that we can talk about in clinic, and this will be discussed during the surgical consultation. How is Botox administered? Botox is injected into target sites in the face and neck, and typically can last for 3 to 6 months, where gradual muscle function then recurs. Subsequent treatments can then be administered. Who is a candidate for Botox? Patients with dynamic wrinkles that have no static component, or in other words, wrinkles that show up when you smile or when you do facial expression. Wrinkles that are always present are harder to treat and may need fillers or consecutive treatments. Who is not a candidate for Botox? Pregnancy, if you have an active infection, keloid or abnormal scarring, bleeding diseases, very thin skin caused by steroids, a compromised immune system, or if you have allergies to Botox, milk allergies, or weaknesses or other disorders. A full list can be found online at Botox. How much does it cost? Pricing is comparable to the local market and can be purchased per session, or bundled prices with multiple sessions are also available. Repeat customers may be eligible for a discount. I do the procedure in my office. How is Botox injected? The area of treatment is selected and a general plan is discussed to gauge treatment options for optimal outcome. The face is prepped for the procedure, a small needle is inserted into the muscle site, and the Botox is injected in different locations. Aftercare instructions are also given. We may take pictures to gauge the effect and outcome. What are common results? Treated muscles start to show some degree of function in about 2 to 3 days with maximal outcome noted in about 1 to 2 weeks. Some touch-ups may be required. The usual desirable effect can last between 3 to 6 months. What are some complications that may occur? Minor bruising, some pain, swelling, or tenderness may occur. Headaches or infection are less common. An undesirable cosmetic effect, such as droopy eyelids, dry eyes, facial asymmetry, difficulty swallowing, or excessive tearing are less common. To contact Dr. Mario Leyba, call 505-727-7050 or go to the website at www.loveless.com/Mario-Leyba-MD.